20 kilometers south of Johannesburg, on the outskirts of Soweto, you will find the world's third largest medical facility, the Chris Hani Baragwanath Academic Hospital. This state-funded hospital relies on public-private partnerships as we strive to be at the forefront of world healthcare. Surgeons for Little Lives was created by pediatric surgeons to improve the care received by our young patients and their families. Baragwanath is our home, and its patients, our inspiration.
Pediatric surgery is a surgical specialty that deals with surgical conditions in children.
So behind me is the neonatal ICU at Chris Hani Baragwanath Hospital. And these are premature, very low birth weight, tiny babies, so often under 2 kilograms, who mostly have had surgery and are recovering from that.
We just finished now a operation or a left pyeloplasty. It's an operation that we did for a child with an obstructed left kidney, that if left untreated, it might lead to kidney failure.
The majority of our time we spent on dealing with children with congenital abnormalities, that's they're born with something wrong. This is a little girl, she's now 9 months old. She was born without an anus, so she's had 3 operations. The first one was to bring out a colostomy or a stoma so that she could poo into a bag, so that we could save her life in the beginning, in the first couple of days of life. And then at 3 months of age, then we did the repair. We made an anus for her. She's gone through that. She's healed beautifully. And now we've just closed her stoma, so that's the last operation that she will need. And our job is to fix them and make them as whole as possible.
So Surgeons for Little Lives was inspired by the fact that we provide a world-class surgical service, but the additional care to our patients and their families was lacking. And we felt it our obligation, as is done in so many other countries in the world, to start a charity to augment the care that we provide.
These people are going to extreme extents to contribute in cash and in kind to make the pediatric surgical experience a better one for our patients.
It's a very broad spectrum of what we've implemented, from admission packs that each new child that comes into the ward receives, to examples like this, which is an outpatient and parental sleepover facility.
With the advent of this building, we are able to form procedures on our patients that might need them immediately in the clinic.
The outpatient department is now separated into 7 different private rooms.
The children have privacy, doctors have allocated spaces to work.
It's really life-changing.
The sleepover facility is amazing. The parents love that.
These mothers had to leave their children and go back home. I'm talking about Mafikeng, I'm talking about KZN. All that has changed. We've got mothers come in, sleep here. They can sleep until the child is discharged, whether it's a month or 2.
These people are so frustrated that their children are sick, but then now that they've got this room, it just brings out the brightness. It gives them hope.
When we arrived here, she got admitted. We stayed for over a week. It took off so much stress that I was already going through as a mom, seeing your baby in hospital.
It's really a dream come true, this maternal facility.
So the playground behind Ward 32 is an excellent example of utilizing an existing space.
We make sure that the patients in the ward are able to come out every day. I must admit, this has brought quite a massive change to the lives of the patients.
So the great thing about Surgeons for Lives is that we've got a very low admin cost. All the money that gets raised goes directly to the children and to the facilities around the children to aid the children and their families.
Everyone that wants to put money into Surgeons for Little Lives, they can directly see where their money is going. So we use it strictly for the patients and the benefits of the patients.
Most of our day-to-day projects are financially small but massively impactful projects. And 2 good examples of that are Jan, who runs a rehabilitative and expressive art project.
We use all the arts to heal. We draw, we dance, and we play.
And the second example is Jessica. Jessica's a psychology student who's completed her master's, and her impact has been unquantifiable. Our core focus is on training both pediatric surgeons.
I come from Italy and I have trained in one of the best hospitals in Italy, I must say. But still, when I came here, I was so amazed by the training that the registrars get here. And in the first 6 months here, I've done much more operations than I've done in the 6 years back at home.
Something that Surgeons for Lives has specifically embraced is training of nursing staff and other allied health professionals to really bring them up to the next level.
Surgeons for Little Life has helped us a lot to take us to the places where we need to go for training.
We're currently working on another big project, which is a lactation unit and breast milk bank.
For very practical reasons, the lactation unit will significantly decrease the burden of disease within our environment.
So my ultimate vision for Surgeons for Lives is to provide a facility and a service that I'd be proud to bring my own child to at Baragwanath, where we can get the best medical care in South Africa.
Our next big project that we've done a lot of work on to date is to build a dedicated pediatric emergency department, as well as to improve our intensive care bed capacity.
We're not going to stop there. We're going to build burns units. We're just going to carry on until infinitum.
It's not donations that allow us to do what we do, but it's investments. It's investments of human capital, it's investments of financial capital. The return on that investment is the youth and children of South Africa. Without them, we aren't going to be able to grow as a nation. With them and enhancing all of their capacity, we can continue to make South Africa great.